I'm here with Dr. Azim Kasmani, Public Health and Preventative Medicine Resident Physician at Queen's University. Welcome, Dr. Kasmani.
Hi, Steve. How are you?
Good. It seems we all are. I guess this may be a short session. We keep promising that, but it never turns out. But it doesn't seem like there's a lot of news, except for, of course, the big news, which is that we seem to be on an even plane right now. Is that still correct?
Yeah, we're doing pretty well here. We've had about 3 weeks now with no new cases, and we don't have any active cases in our region right now, so that's quite reassuring.
And every case that's been through here has been resolved, correct? And none of them have involved a fatality.
Exactly. So that's within our region. That's very good news, and it again shows how well our community is doing and how seriously our community is taking this. So we here at the Public Health Unit are very appreciative of everyone and their efforts so far.
And the message, of course, now is going to have to be keep it up, because we're talking now about gradual reopening of some businesses. I guess golf courses are next, and a few other things. In terms of that, it's obviously going to be a mistake for people to think that this means that we're out of the woods, that we can relax things. Yes, we can go to the golf course, but let's carry the conversation on from 6 feet.
Exactly. And so I haven't heard about golf courses yet, so that's exciting news for me. Looking forward to getting outside a bit. Hopefully we stop seeing snow in May and we can get out there. But exactly what you're saying is getting a chance is to continue to take this seriously, make sure we're continuing our physical distancing measures. Outside is a great place to be. I haven't seen any evidence of virus spreading outside, and so but while we're there, if we're within close quarters, we want to make sure, or we want to avoid that, because that could be a situation where the virus can transmit between people. I think we've also seen our neighbors to the south in the US, as they've opened up and certain states have opened up more, they've seen an increase in cases as well. Germany has reported an increase in cases, and Germany did an excellent job initially with their control. And they're still doing a good job, but they have had the number of cases increase as they open up. So we can expect that to some degree here, and the measure of our success is how well we can control those then. And so that's why the province has put into place their roadmap for reopening, where they put into place a number of factors that have to be present before you can reopen. So if there are cases, they don't turn into big outbreaks.
Right, and people have to be aware that if things start to reopen again, and then we start to see the curve slope up in a threatening way, that we may have to go back to what we've been doing.
Yeah, the province has outlined 2 to 4 week periods where you would make one change and then you would reassess over the next 2 to 4 weeks to see what happens. If things are still getting better, then you can reopen to the next phase. But if you're seeing a huge increase in the number of cases, then you may have to take a step backwards, reassess, and we may have to then have some time to control any outbreaks that are happening as a result.
And certainly the seriousness with which we've taken this has, again, prepared the hospitals, because the big fear was that there'd be an uptick in cases that the hospitals couldn't handle. Now we're at the point where, yeah, if we get a surge, we've got the infrastructure in place, we bought that time that we need.
Yeah, it's a bit of a double-edged sword, because the better we do at protecting ourselves in the first place, that leaves us vulnerable to, we don't have immunity basically, and so that leaves us vulnerable to another wave. Our hospital partners and primary care partners have done a great job of preparing, putting in place the infrastructure, and we've also learned a lot from other jurisdictions about how to manage patients who have this illness. And so it's ensuring we stay on top of that, ensuring that if we do see an uptake in cases, that we're able to quickly adjust, make those resources available, and treat everyone who's unwell. and our hospital partners are working hard on that.
And if we'd had, if people hadn't taken it seriously and we'd had a major outbreak at the beginning, we wouldn't have had that ability, right?
It probably would have been a lot more difficult. It's easier to learn from the experience of others, looking at places like New York, Italy, rather than having to learn on the fly as we're going here. So we're really appreciative of our community and how seriously they took it.
See, speaking of being appreciative, I'd just like to add a note of thanks to the KFLA and yourself and everybody affiliated and associated. One of the things that came out as a good news locally is that you guys took seriously the potential for major problems inside long-term care facilities, the prisons and so forth, which doesn't appear to have happened elsewhere. Is that a case of just having a little extra time to react and think that through and say, hey, we'd better pay attention? Or did you learn from the bad experiences of other communities?
I think there's a few different things that go into that. One, there's a little bit of luck. We didn't, as you're saying, we didn't have a number of cases initially here, but sometimes we make our own luck. And really, it's our community members who've made that luck for us by taking those steps, by practicing good physical distancing, and by ensuring that the virus wasn't introduced into our long-term care facilities. I'm also very lucky to work with Dr. Moore, and the work he's done in preparing, I've learned a great deal, so it's a really good place for me to train. Seeing the relationships he's built, seeing the relationships all of our team members have built, having public health inspectors work with individual long-term care homes, go in there. Like politics is all local, I think public health is all local. And it's very much about those one-on-one relationships, making sure that the long-term care home knows they can call their inspector that they've been assigned, knowing that our health system partners can always call Dr. Moore whenever they need to. And he takes a really proactive approach. So I've learned a lot about how to manage outbreaks and also about leadership from him, and I'm very appreciative of that. And continue to learn.
Yeah, well, we all have to learn no matter what we do, and I think in the medical profession as much as or more so than anything else. Speaking of learning, and again, we talked earlier about things being reopened, the spring coming, finally, it's a beautiful day out. People are going to want to be going out onto the trails and getting their bikes out and so forth. Let's just go over briefly what precautions people should be taking if they're out taking advantage of the sun and walking in parks, riding their bikes.
Yeah, I think the first thing we can do is start at screening. So if you're feeling unwell, stay home, and contact your family doctor or contact our assessment center and see if you can get tested. So that's the first thing. Don't go out there if you're feeling unwell. When you do go out, stick to if you're in close proximity with anyone, make sure it's people who you live in the same house as. So you don't want to be intermingling with a bunch of different groups of people, because that'll increase your contacts and your chance of coming into contact with the virus. So keep that 2-meter distance and spend that time outside. It's really good for your mental health, your physical health. Get some exercise as well. And you can see people out there, you can talk to them, but keep that 2-meter distance as you go. And so that's really the important thing. So provincial parks are opening this weekend. That's a good opportunity to get outside. That creates a lot of extra green space where people can go and access and then don't have to congregate. You don't want to go to playgrounds, for example, or sit on a bench with somebody else, because those things will put you in close proximity. And we know that we don't have the capacity to clean all the playgrounds and make sure that they are sanitized between everybody using them. And so stick to your family, and it's tougher with kids as well, but remind them and encourage them as well. And keep safe, and that'll preserve your health and our community's health.
That's a good note to end on. Well, we'll talk to you again next week. Stay safe and get out and get some sun.
You as well. Take care. Enjoy the sunshine. Yeah.